Hi, I'm Amber. I'm a nursing student. I have your patient room 621.
Oh, okay. Hi, Amber. In room 621, we have Greg Lutz, or Lutz. He's a 67-year-old white male. He's 5'11 and 171 pounds. He's a full code and has no known allergies. Um, he is on an 1,800 calorie diabetic diet with a 2-gram sodium restriction, and he was admitted directly from his provider's office. His primary diagnosis currently is stage 2 diabetic ulcer on his right heel. Secondary is diabetes mellitus type 1. Uh, Patient was diagnosed with the diabetes 20 years ago and has been monitoring it and been insulin dependent since that time. And he generally has a really good range for his insulin in the 120s. However, within the last 5 days, he complains that he's had increased blood sugars and they've been up in the 300s. Which also occurs at the same time as this non-healing wound on his right heel that he noticed about 3 weeks ago. Um, his A1Cs about 3 months ago were 5.2, which was really good, and now they're 6.5, and it's just we need to keep an eye on that. 6.5 isn't horrible; it's fair, but we need to make sure it doesn't keep creeping up. Um, he has a right peripheral forearm saline lock IV. Um, he states that the wound earlier was a pain scale of 6 out of 0 through 10, and we gave him 4 milligram IV of morphine sulfate, and it came down, and he now is doing really well with just a pain level of 1. So we need to keep an eye on that every 4 hours and just stay on top of the pain for that. The wound itself is, like I said, it's on the right heel. No tunneling. The wound base is pink. It's 5.5 centimeters by 2.5 and 3 centimeters deep. Currently, until he sees the wound care specialist tomorrow, we are using the 0.9% saline to clean that out and using a dry dressing on that until tomorrow, and he'll see the wound care specialist. He also, his calcium is low, so we need to keep an eye on his labs, and there are some other pending labs that we can talk about. He's on sliding scale insulin right now, and he has been um, his blood sugar, when I just checked it at 8:30 or 20:30, was 242. So we will go to the sliding scale and see what he needs for that. We will be administering here at 2100 the NPH and regular insulin, and those are good to mix together. So we will be mixing those and giving those to him to help bring that sugar level down. His vital signs right now, he has a temperature 98.4, pulse is 76. He's got 96 O2 stats on room air, and blood pressure is 128 over 70. We're doing vital signs Q 8 hours, and unless we need to, prior to him getting the morphine as well, we want to make sure that his respiratory um, has not gone down. So he does get the insulin various times throughout the day, and this 9 o'clock will be his evening insulin. His eyes are equal and reactive, round. His lungs are clear to auscultation. He has unlabored breathing. He does wear glasses and has 20/20 vision with the glasses. He states no hearing loss, vertigo or dizziness, no headaches, no sinus issues, and denies cough Patient states no smoking, denies any tobacco use. He drinks one beer per week on a Friday night. One of his activities is he goes out bowling on Friday night with his friends, and basically, though, that he states that's the only exercise that he gets. Um, his heart rate and rhythm are within normal ranges, denies chest pain or shortness of breath or palpitations. He has active bowel sounds in all four quadrants, no distension noted. He states urine and bowel patterns to be normal, and he has voided 320 milliliters today, um, and states his last bowel movement was this morning, and it was normal, brown, um, and regular. Let's see. He does have some tingling in his bilateral extremities. They've seemed worse in the last 3 months. He seems to be dealing with some neuropathy pain, and the the change in that pattern could be with his increase in sugar level. So we do want to do some education with him, education on his diet, make sure that he is following his diet, some glucose control, and his insulin injections. He has been using insulin at home before, but we want to make sure he's storing the insulin properly and using it as needed and having like food nearby and snacks and things like that. Um, let's see. Are there any other questions I can answer for you right now?
Yes. Why specifically is the client receiving this medication?
He's getting the insulin because the insulin will, um, well, he's getting the insulin because of his blood sugar, and it to control it, since it keeps going all over the place, the insulin is better than just a normal metformin or glucophage type medication. Um, so we want to get it down quickly, and the insulin will do that.
And what action does this medication have on the body?
Um, what it does is the insulin will attach to the sugar, and it breaks down the sugar in the blood, distributing it into the muscle and the fat.
And when should you question administering this medication?
There's some different signs and symptoms that you can look for. You want to make sure the patient, um, you know, they could be hypo or hyperglycemic if they're diaphoretic oriented, if they're having any confusion. Um, you want to watch after giving the medication, like the redness and swelling to the injection site. So you want to keep track of that. Um, Weakness, tremors, irritability, things like that, you just need to make sure to look for.
And does this medication have a therapeutic serum level?
We like to keep the blood sugar controlled between 70 and 100. He had been at 120, and they're pretty happy with that. But his levels now, being in the 300s, are dangerous.
And which vital signs must be monitored?
Well, vital signs are always good to have monitoring of, but you want to make sure, because for hypoglycemia and hyperglycemia, you can get headaches and various pain, but you can also become very tacky and have um, a high heart rate. So you want to just make sure to check all that, the respirations, make sure that he is just functioning appropriately, and obviously the blood sugar checks.
And which physiological parameters should be monitored when the medication is being administered?
You want to evaluate the site and make sure he knows that insulin can be given, it's given subcutaneously, and it can be given like in the arm, the belly, the thigh, but you want to make sure you rotate and don't put it in the same place all the time, because if you do, you can start getting hard, lumpy fat deposits.
And what interventions must be taught to the client to ensure this medication is administered safely in the hospital setting?
You want to make sure that things aren't, his diet is pretty controlled as far as the cafeteria goes and as far as the meals that are going to be coming up from there. However, a lot of times you'll have visitors bringing things in, sodas, candy, things that the patient likes to have, and um, that could throw it off as well. But you also want him to make sure to notify anyone if he's having any of these changes in um, orientation, if he's having any change of thought processes, confusion, if he's very diaphoretic, shakiness, tremors, weakness.
And what interventions must be taught for taking this medication safely at home?
He may have already taken this one at home, I'm not sure, but we want to make sure that he is taking care of himself and the insulin as needed. Um, Once the insulin is opened, it can be kept in the refrigerator for up to a month, and you want to make sure that whatever insulin he has is just being properly stored. You also want to make sure that he has some, high protein snacks and some things nearby, just control for any possibilities of hyper or hypoglycemia.
And what are side effects and potential adverse effects?
Some side effects to the insulin. First of all, if you're putting it in the stomach, you want to make sure to keep it an inch or two away from the umbilicus, the belly button area. And you want to, as I said, monitor the different sites because you don't want to get too many, you don't want to get those lumpy, fatty particles or bumps in your stomach or arms or things like that. So you want to monitor that. And could you repeat the question? I don't know why I just went blank.
I'll go to the next one. How will you know the medication is effective?
Okay. He's taking this at 9 o'clock, so we, most generally he'll be asleep, but we will want to monitor him and check his blood glucose at the normal times and make sure it's come down.
All right, thank you for answering my questions.
Sure.
Are you going in there to give it to him?
I am. Would you want to come with me?
Yes, please.
Let me get a drink of water real quick. Okay, let's go see Mr. Lutz. Hi, Mr. Lutz. My name is Gina. I am your nurse. Would you mind if a nursing student came in to visit? Okay. Come on in. How are you feeling today?
Feeling okay.
Alrighty. It's getting kind of late. I'm sure you're getting tired. I did just take your blood sugar level about 30 minutes ago, and it was 242. The doctor has you on a sliding scale, and I want to give you the proper units for that. You're going to be getting NPH and regular insulin. Do you understand what that means to mix the two insulins?
Not really.
Okay, the NPH is one that we consider cloudy, and the other is clear, and we mix those. They're compatible, so we can mix those together, and they just work together to bring your blood sugar down a little bit better. Okay? Let's see. Blood sugar is 242, and according to the scale, it says if it's between 241 to 300, you get 16 units of regular. And you will get 20 units of the NPH on top of that.
Okay.
Okay? The NPH is a normal 20 units twice a day. That's what you got this morning at 8 o'clock, or what you will get tomorrow morning at 8. So you'll get the 20 units twice a day, but then the regular is based on your blood sugar. Does that make more sense? Sorry. Okay. And could you give me your name and age, please? G Lutz, 67. Okay. Do you have any allergies, Mr. Lutz?
No.
Are you having any feeling of hypo or hyperglycemia right now?
No.
And the largest diameter is 3 centimeters. One base peak, no county, and has 5 out of 5 muscle strength.
Now, when we do the medication, we have some different rights of medication. You'll notice I check that it's the right time, which it's 9 o'clock when you are to receive that. I check that it's the right dosage, and that's what we were just discussing, that you're getting 20 units of NPH and 16 of the regular. Sticky gloves. We want to check it with the MAR, which is our medical record here in the computer. And we want to scan it and make sure that it's compatible.
So the patient is the one infection they won't
Goodness sakes. Now, do you know where you got your injection last time?
In my stomach.
In your stomach? Do you want to do your stomach again? Would you prefer your arm or your thigh? Okay. How about, was it on the right side or left?
Right.
Okay. You want to just go to the left right now? Okay. And you just want to make sure, I don't know how you do it at home, but you want to make sure that you do rotate those sites, because you could start noticing some lumpy deposits, fat deposits that are there. And we want to try to prevent from you doing that. And always make sure that you keep the injection about 1 to 2 inches away from the umbilicus, okay?
Okay.
Were you, how was your meal this evening?
Very good.
That's great. How are you handling the sodium restriction and
Not so
the
good.
diet? Not so good. Well, I do have some information for you on an 1,800 calorie diet, so you can mix it up a little bit at home. Just try not to, like the food that comes in, if you have your wife come in or any friends or family that bring you any food, make sure you get that approved by us first. Even if it's just a little piece of candy, we want to make sure we know what's going on.
Okay.
Okay?
Okay, and which vital signs must be monitored?
Make sure that the top of the insulin containers are clean.
Wow. Okay, which physiological parameters should be monitored when the medication is being used?
Have your band again, please? Can you repeat your name and age?
G Lutz, 67.
Thank
Okay,
you.
and what interventions must be taught to the client to ensure the medication is administered in the hospital setting?
And we want to compare the regular insulin and check the date and the clarity. That's the NPH. So see, that's the and check the regular, which is clear, and the date is good. Okay.
And what interventions must be taught for taking the medication safely at home?
approximately both each sides. They blood glucose levels and administer the insulin. Also, I'll teach the proper storage of the insulin and proper disposal of the insulin. And check the dating of the extraction of the medication.
Wow, what are the side effects and potential adverse reactions?
For this medication, one common one is hypoglycemia. The glucose levels are lower than
Okay, so we want to
60. 60.
inject
And also
20 of air
reactions,
into the cloudy.
it's not common, it's local alcohol
And we
prevalent.
actually take it out and
Redness,
inject
swelling of the
16 of air.
And how do you know that the
Into the
medication
regular.
is effective?
How know the medication is effective by checking the glucose levels of the patient and see if there's any high disease
And now that we
blood tissue.
did that, we can take the
Okay.
16 out.
So you ready?
Yep.
Let's go. Knock knock.
Hello?
Good morning, so fine.
Hello.
How are you doing?
I'm doing good.
Good.
And now the 20.
And I have a student named John from level 1.
Hey, Doc. Hi.
Is it okay to come in and observe me?
Sure.
Great.
Okay, so we
So
got
I'm
the
going to
36.
administer insulin. It's going to be 16 minutes since
We will
your latest
recap that.
glucose reading were 290. So the sliding scale says that we will
That's
be
ready for you.
16 minutes of insulin. And it's like regular. So do you have any allergies that I should be aware before administering?
You seem sleepy. Are you ready for me to get this over with so you can go to sleep? Yeah.
Have you eaten your
feeling-
meals?
Okay.
Have you done any extreme exercises?
Okay, so we'll put this on the left side since you already did the right. Be a little cool.
Okay, so could I have your first name and last name, please?
We'll do the bevel up.
Okay, and your date of birth.
Yeah, this might sting just a little bit. I'm gonna go straight in.
And you said you have no allergies.
Okay.
Let's see what you said.
How'd that feel? Was that okay?
So it's okay.
Okay.
Can I do it again? So have you taken this medication before? Are you know any side effects?
Okay. I'm going to
Can you always
finish
tell me two side effects?
entering on in here because I need to do the other one.
Yeah. Also, you feel easy, hunger, I also couldn't hang out just to go over it and review some of them. Is it something you forgot?
Are you still doing okay with your pain level? I know it had come down quite a bit. Okay, let me scan your armband again. I think you've told me your name a few times now.
Look for
But I need to make sure.
the drug medication by route, by dosage, and by time.
So look, you're doing a good job.
Okay.
So are you feeling okay right now?
Mm-hmm.
Okay.
And go on to continuation.
Do you know what some of the signs are that you would want to look for in your stomach area?
Mm,
And can you tell me where was your last injection site?
no.
Okay, look for, like, if you start feeling any itchiness or
You're right?
redness,
Okay,
swelling,
so I'll do
where
your
the
last.
injection was given, you'll wanna make sure to let us know.
Okay.
That way we're.
Well, the worst people say this, I didn't do anything to my stomach last time, so I get the fatty lumps in my stomach. That's what that is?
Not necessarily.
And how do you, store your medication at home? Your insulin that you've been using?
In the fridge.
Okay, that's good. Once you, now, you know that
So I guess I wrote
if you've opened a vial, that you need to do that and keep it in the fridge, but if you have unopened vials, as long as they're not expired, you can keep those, like in a medicine cabinet or something like that.
check again. The right
I don't know if you have
medication,
children, but sometimes, you know, keeping
route,
medications like that in the fridge, you kind of worry about, so you wanna do as little as possible.
and since it's a highlight medication, we will check the millimeters.
And you can do that for 30 days.
So can you check it again?
It's so good.
And you just feel like it's for the future, right?
Sorry, thank you for being patient, I'm almost finished here.
It's okay.
How are you doing? Good? So I'll document this real quick and then we'll go over your diabetic diet.
Okay. You are good. Now, I know we had discussed a little bit about education for you, and I know that you have been using insulin for a long time, and you know, you may have used some different types. With the regular insulin, it peaks in 1 to 5 hours, it lasts 6 to 10, and it will work, you know, throughout the night, and then in the morning, I'll be checking you. And I know you probably get tired of the finger sticks and things like that, but we just wanna make sure we're keeping you at a good level. It's been kinda high lately. And by doing that, hopefully, the ulcer on your foot will clear up a little bit faster.
Okay.
Okay. So what I have here, I have some things to know about diabetes that we have here at the hospital. Now, like I said, I know you've had diabetes for 20 years, so you probably know maybe even more than I do, but things are changing all the time, new medications and things. So this will give you a little bit of an idea about that and things that you can do to help with that. In your 1800 calorie diet, you know, we could sit down and talk about sizes of meals or whoever fixes the food in the family, you know, if you would like to have them here, we can have you meet with a dietitian. But this will give you some different ideas of things that you can have, or the sizes of what you should eat, and like how much protein, carbs, things like that. So if you have any other questions, just feel free to ask, and we can set up any of those consultations for you, okay?
Okay.
Is there anything I can get for you before I
Nope.
go back out? Okay, I will be checking in with you to make sure you're doing okay. Keep in mind if you start feeling diaphoretic, so if you start feeling sweaty, if you get irritable, let us know. We'll go ahead and just check your blood sugar and make sure something's not, you know, going right. So you have your call light there, and you know that if you need anything to drink, just to give us a ring, okay?
Okay, thank you.
Thank you so much.
Is there anything you need before? You're very welcome.
Okay.
I have a couple more questions for
Sure.
you. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yeah, I wanted to check with him to make sure, well, first, one of the most important things before administering any medication is that we want to check the rights of the medication. And there's 5 of those. We check the right dose, the time, the route, we check their identification and the medication. And thanks to the computer systems now and the Pixis, those things will alert us if there's any issues, but we really need to be educated and have the knowledge of what's going on with that medication. So I did want to check with him and make sure he wasn't feeling any hypoglycemic issues. So if he was, then maybe we would want to do another blood sugar check to make sure we weren't going to be giving too much insulin,
Okay,
and check the sliding scale as well.
and did this information affect your decision to administer the medication?
It did. He was doing well, but we needed to, since we had just taken the blood sugar 30 minutes prior, we needed to get that insulin into his system so it would work properly.
Alright, one more question. Did this information affect how you administered this medication?
It did. I had the 2 different insulins that I had to mix. Every evening at 9 o'clock, he automatically gets the 20 units of the NPH insulin, but then based on the sliding scale of what the blood sugar is what he would get for the regular insulin, if that makes sense.
Yes. Alright, thank you so much for showing me.
Oh, absolutely. Come back anytime.